Hi everybody, and thanks for watching our video on what exactly goes on when your cat comes in for a dental cleaning. Dr. Cohn, this is Piper, and
Hello.
This is Miss Hallie, and she is here to have her teeth cleaned today. And so the first part of what we do is we do an exam on Hallie to make sure she seems healthy enough to go under anesthesia. And so we're going to reevaluate her mouth as well, so we have some idea of what to expect when we do her dental work. So we're going to take a look in here, and she definitely has some tartar buildup on her back upper teeth. The tip of this canine tooth is fractured, so we're going to watch real carefully when she's under. We're going to x-ray those teeth and make sure everything looks healthy. Not too bad, Miss Hallie. Good job. So we're going to take a listen to her heart and lungs. Everything sounds good there. We're going to take a feel of her belly just to make sure everything feels good in her tummy. And she's just kind of hiding in her carrier here. She says, I'm a little nervous.
Oh, it's
I know
okay.
you didn't like that. Okay, okay. Everything looks good. We're going to go ahead and put you on the scale and check your weight here, sweet pea.
Thank you. 9.4. Oh, we shocked each other. 9.5.
Okay. So Hallie was 9.5 pounds today, and she is 4 years old. So we're going to draw some blood for a pre-anesthetic panel just to make sure everything's okay with all of Hallie's organ function. And the blood work that we run is based on their age. So she's going to get the panel that we do for cats that are less than 7 years old. We're going to put her in a towel here just to make her feel a little bit more secure. And Octavia is going to come help us. I know, honey, it's very scary.
Okay.
It's very scary. I know, sweetheart. It's okay. You're okay. So we're going to draw about 2 cc's of blood from her, which is less than half a teaspoon. So we don't need very much to be able to get all the information that we need. She's being very, very good.
Yes, you're very good.
Okay, I know. That was the worst part, sweetie. And then once we know that Hallie's vein is, we're holding off the vein right now so that it doesn't continue to bleed, we're going to put her back in her cage for a while so that she can relax while we run her blood work and make sure that everything is good with her. We're going to comb you just to make sure you don't have any fleas.
Where are you going, Mrs.?
You're very, you like that, don't you? You like being combed. That's okay. That's not so bad. That part's not so bad. And we're going to give her medication that will help to relax her. Can you turn it over?
Yes.
I know, honey. It's going to make you feel a little less nervous, okay? Good girl. Okay, Hallie, you can go back. So Hallie's blood work looks good, and Piper is going to place her IV catheter, and then she's going to induce anesthesia and intubate her, put a tube down her trachea.
our induction agents into her vein, and she's gonna get a little sleepy. Lacey's gonna hold open her mouth and her tongue, and I'm gonna go ahead and put an E-tube down her throat to help her breathe while she's anesthetized. Go ahead and turn on the oxygen pump from here. Hook her up to oxygen. The oxygen is going to act as a carrier gas. It's going to carry the ISO into her lungs for us. Tie in the tube. Fine. Lacey's going to go ahead and give a breath, and I'm going to sit here, listen for a leak, make sure that the tube fits okay. She's coughing around. Sometimes it's hard. Do you hear anything, or is it holding?
No.
You hear a little leak. So because there's a little leak, I'm just going to blow up the cuff, just a little bit of air, and that's just going to fill up the tube around her trachea. We do this especially since we're spraying water in the mouth. We want a nice snug fit. Good? Holding? Yeah. Okay. We're going to go ahead and lubricate her eyes because she can't blink while she's under anesthesia. This will help moisten, keep the eyes nice and moistened, and then I cover her face as well. Put a towel over her because patients can get cold while they're anesthetized. Go ahead and hook up her IV fluids. This will help maintain her blood pressure and keep her hydrated. She doesn't have a lot of teeth on her upper teeth. She's missing a couple. It looks like they were, it could have been extracted, I'm not sure. The gum's nice and quiet, so it looks like they were professionally extracted, but we'll see better when we take x-rays.
Okay, so you may have noticed that due to technical difficulties, it's a different day and we're working with a different cat. Hallie is doing great, but this is Mr. Brio, and so we're just getting started. Piper's getting started with cleaning, doing the cleaning and assessing of his mouth, and so she's going to explain how we chart any abnormalities in his mouth.
Okay, so one of the most important things that we do when we clean the teeth is that we chart, and that's when we look at each tooth, and we have a nice little outline here, and we look at each tooth and we check the gum line, see if there's any pockets, see if there's any recession, and we do this by using this instrument. It's a probe on one side and an explorer on the other. Now this is the same instrument that would be used in human medicine. So I go to each and every tooth and I see if there's any pockets or any cavities, what we call resorptive lesions. I'm going to show you there is an abnormality. So on Mr. Brio here, you can see that the gum has receded a little bit. This is its natural gum line. So I can see that each one of these little tick marks is 1 millimeter, and it seems small, but it is significant. So Mr. Brio here has a gingival recession of about 2 millimeters. So we'll go ahead and we'll chart that under the canine on his dental chart. So I'll just go ahead. Gingival recession of 2. And Dr. Cohn will know that's a gingival recession of 2 millimeters. And then I'll go to the next little tooth. That one feels good. That one feels good. Nice and smooth here. And you can see, just like the upper canine, there's some recession here. And we're going to want to mark that and keep an eye on it in the future. So we've got a little bit of a recession right here. Got a little bit of a vercation exclusion here. And a recession here. And a recession of about 2. I have a vercation of 1. And a GR of 1. And again, it's good. You need to explore all sides of the tooth. After we hand scale and ultrasonic the teeth to get all the tartar and calculus off, we'll then polish each tooth. Again, just like human medicine.
So with every patient that's under anesthesia, there's always a technician monitoring them, blood pressure, heart rate, temperature, respiration rates, and giving them assisted breaths when needed. So this screen right here is our monitoring form. So it has the time of each parameter, and then each section is labeled with the parameter that was taken. And this is how we monitor our anesthesia. It also will include the doctor that we're doing, IV catheter information, and all medication that we've used for the patients.
So we just took a x-ray of these 3 lower teeth. And though these teeth look great on the top, if you notice here, and Dr. Cohn will be able to diagnose this, you can see that this root is going away. Okay, so it's very significant, and Dr. Cohn will act accordingly.
So when we look at this x-ray from Brio, it's this lower left side of his mouth, and we have 2 teeth that look quite normal, and then we have this tooth here where, if you notice, on all these other tooth roots we see this nice black line around it, and it looks quite clear. We see the black line down through the middle, which represents the pulp. On this tooth here, you don't see much root at all. You don't see that black line down through the middle. You don't see the line around it. So that means that root is starting to resorb. And we see a lot of what are called tooth resorptions in cats, which is where the tooth just starts to eat itself away. And the only treatment is extraction. Otherwise, that's going to end up being very painful for him. So we are going to need to do at least 1 extraction on Brio today. And I'm going to go ahead and evaluate the rest of his x-rays now. So this one looks really nice. This is his upper right side. And we can see nice clear tooth roots. Everything looks good. This is the upper right canine, which looks good. There's a nice black line all the way around the root. So that looks like a pretty healthy tooth. And we do go through, we look at every single tooth in the mouth, both on our exam and also on x-ray. So these are the top incisors, and they all look good. This is just a little bit of some polish left here. That's the white part on the x-ray. So this is the right lower side of Brio's mouth, and again, this root here is resorbing. It's just not clean. We don't see the black line all the way around it. So it looks like that same tooth on both sides of his mouth is going to need to be extracted. Everything else looks good though. So our first step in doing an extraction is to place a local block. So just like your dentist would do, giving you Novocaine before they were going to do a filling. And in this case, what we're doing is we're feeling for a nerve bundle here at the back of his mouth, and we're feeling for a little hole in the bone called the foramen, and that tells us where we're going to aim our needle. Checking to make sure I'm not going into a blood vessel, and then I'm going to go ahead and inject the local block right where we need it to be. And then we're going to give this a few minutes to work before we start the extraction. Okay, so we've finished up our extractions on Brio, and we're going to go ahead and turn his gas off. That means he's now going to breathe out the anesthesia gas that's already in his system, and within a few minutes he will be waking up. That's coughing. Now we're going to wait for him to swallow, because we want to make sure that was a swallow. We want to make sure that if anything's in his throat, he can swallow it and it won't go down his trachea. So I'm going to pull his endotracheal tube now. I'm just going to pull it straight out and remove it. And then he gets to go back to his recovery cage. So Brio is doing very well. We are going to be pulling his IV catheter here in a little bit, and he is going to be going home on some pain medication, and then we'll be seeing him back in 2 weeks to make sure those extraction sites healed up well. Thanks for watching the dental video. Say bye, Brio.